Good morning, everyone. Thanks for coming. Thank you for having us. We're here to talk today about incidents, accidents, actions. So I was going to start with some scary-looking stats like this. I thought, actually, you guys don't need me to come here and tell you about the stats, right? Because you know the impact of incidents and accidents. Instead, I thought what I'd really talk about was the fact that when an event happens, it doesn't just affect the person that it happens to. Obviously, it does. And that's the person that's impacted the most. Really what I found is, from talking to customers, that the effects of events really ripple outwards to the friends and family who worry about that event. Another one happening, is another one going to happen? The care teams who are already stretched, we then have to provide additional care to that individual and worry about logging it and following up correctly. Managers and leaders who worries, is this an isolated incident? Is there a systemic issue? Is there a pattern? Are there events that are trends and patterns that are happening there that we should be looking at? And the effects ripple out to the whole organization in terms of financial impacts, reputational impacts, inspections, all of those things. So what we built is product in Nourish Safety. And what we're going to talk to you today is about how we set out to understand and tackle this problem, the solution that we built in response to that, and where we are really on that journey and what the future is. So we can hear about it from a few different perspectives. So I'm Mark. I've spent about the last 15 years kind of building digital products in a few different sectors. But I'm relatively new to Nourish. I'm into Nourish about 6 months ago, around about halfway through this project. So it's been really interesting for me to hear about a lot of the learnings that happened before I joined, and then kind of following through the solution on those problems. And not so new to Nourish is Carrie.
Hey everyone, I'm Carrie Taylor. I'm the Clinical Safety Officer at Nourish. So I head up our practice team that sits very much aligned with product, but between us as practitioners, we have a real wealth of knowledge across different care types and different care settings in health and social care. So I have been with Nourish for about 3 years. So I've been part of Nourish Safety since its sort of very early conception. But prior to that, I worked in social care in senior ops for 10, 11 years. So felt very well-versed in some of the challenges around incident and event management. So really wanted to bring that to this product and help people with those challenges.
Hello everybody, I'm Lyndsay Atkinson-Swales and I'm the Director of Operations and Quality for St Anne's Community Services, which is a charity in the northeast of England and Yorkshire. I've been in social care for the last 20 years. I started as a support worker, care worker. Are any care workers in? Support workers? Okay, right. Started my career in incident and accidents, writing incidents and accidents, carbon copy paper. And since then, I've used a variety of different methods, tools, systems, etc. to record incidents and accidents. And now we're using Nourish Safety and been using this system for about a month.
Thank you very much, Lyndsay. Thanks for joining us. So, Carrie, you obviously were here at the start when we decided to tackle this problem. Could you just tell us a bit about the approach that we took?
Sure. So, as you said before, it does have a rippling effect. So it's not just the person affected. We know that it impacts so many individuals, systems, organisations, and we really, really wanted to understand everybody's perspective. We really wanted to dig into what the challenges were from every level, but with a real focus on what should the outcome be. So what should you get out of effective incident management? And I truly understand that at every level. So the people being supported, needing to feel safe, needing to feel cared for, responding to, care workers, team members to feel like they could report easily and without fear of punitive action, repercussions. For managers and team leaders to have oversight and confidence in the care that's being delivered in their service. And obviously organisationally to feel like you are really embedding that culture of learning and that you can really take that through and to see massive continuous improvement across your organisation. So what was really important to us is that we very much were co-producing this and collaborating with our customers to really understand their challenges and therefore be able to come up with a solution that works from every level. taking into account direct care, but operations as well, and how we fit all of that together to have a really positive impact.
You were one of one of those customers we came to kind of this time last year to understand what those problems were. And for you, what was the biggest challenge that you were feeling at that point?
The biggest challenges were, the immediate reporting for the support worker or the frontline staff member on the ground, how long that could take, or between the incident and the time taken to write down that whole detail. So a quick capture was something that we discussed. And then the other kind of issues were a lot of instant accident systems were quite generic in terms of the next steps of the process. So the forms were always the same. And that was irrelevant of what the type of incident category was or the severity of the incident. So there was a bit of a lack of learning for managers and staff on actually if X happens, so what are the things that we have to do? And if we can set that into a process like Nourish Safety, they can learn at the same time as also making sure that all those things are done. And then that learning piece back in, which I think for any care provider was really difficult. But within Nourish Safety, we developed a huddle so that learning could happen very, very quickly, but then go through into that team meeting space, come back into kind of the system, which is really, really positive. So they were our difficulties.
Brilliant. And I guess that was quite a common challenge. What perhaps were some of the other ones that we found when talking to expressed to understand more challenges?
Yeah, so there were a lot of leaks that emerged from obviously consultation with customers and looking at existing data. Definitely underreporting came out as a theme. So that might have been, there were various different causes, access to systems, different people knowing what forms to fill in, who do they go to, how do I get them at the right place. As I said, people fearing repercussions or that this would be viewed negatively. And there was also fragmented processes. So we have this person that is in the centre of our event and they need to have continued care and support potentially on the back of that event for them. But you've also got the process around how we managed it as an event. Did we do the right things? Were the right policies followed? Did team members have the right knowledge they needed? And that process kind of sat more with senior teams of management. And how do you make sure those two fits align? And so that care teams could really feel like there is a positive outcome to them reporting. And how do we join all of that up? And then we found a lot of siloed data. It was really hard for organisations to join that data together from person to person, service to service, and to have a really clear oversight and confidence that we know exactly what's going on in our services. And across all of that was the theme of learning. So as Lyndsay said, how do we really make sure that at every point we are taking those learnings and we're really embedding them in our organisation for that continuous proof. People were definitely struggling to evidence that was happening and those things were going on.
Makes sense. So then we set out to build a solution, right? And I think when we think about the solution that we set out to build, really it had these three key themes, which is around removing those barriers. So tackling that problem of underreporting, what could we do? And realistically, the number one thing that we could do there was embedding it fully within Nourish. So within those workflows that already existed in terms of the way that people log care today, making it similar as possible so that they're going to the same place using the same Blue Plus button to raise an event, where they're also currently going to raise a care interaction today. Along with that, we also made the kind of the flow for capturing that event really fast, which we kind of show you in a minute. And then encouraging best practice through these care workflows and these care pathways, which we're also going to show a bit about, which for me really kind of embeds this best practice, makes it very easy, almost hard not to follow the best practice when an event happens, to be capturing the right information, to be making sure the lessons are learned, that actions taken off of that bit. And then finally, and probably most importantly, capturing and surfacing that data, because obviously if you're capturing all that data is one thing, there's really surfacing it and visualizing it in a way that allows you to spot those trends and patterns, and so that you can understand what's causing these events, these accidents to happen, and what steps can we take to perhaps reduce those and do even prevent. So those are the three key things. And ultimately, and believe that will provide better outcomes for the individuals who are providing care for, but for the whole organisation. So a little bit about that. So one of the things we did, like I said, around creating that, making it easy to log an incident, embedding it fully within Nourish, but also this two-step process. So one of the things we co-created with the sector was this idea that actually want to create this capture event as quickly as possible after the event. You also need to care for the individual. So we now, in Nourish Safety, allow people to create this initial event capturing just the most important bits of information. So when did it happen? What was the event? What time did it happen? And how severe was it? And then they can come back later on, perhaps when they've dealt with the initial incident, they can fill in the details. And because that's happening a bit later, you can afford for that to be more detailed, which means more data, which means more opportunity for learning later on. And alongside that, configurable escalations. So one of the things that I really heard was that people don't want to be notified about every single incident. They want to be able to kind of pick and choose. Perhaps you're a PBS lead and you really want to hear about the behavioural incidents, but not so much about the others. You want to hear about moderate or severe or higher incidents, but you don't want to notify for every single one. Under these configurable escalations, you can set that on a role-based permission basis so that everyone can get notified about the incidents that they care about these. So Lyndsay, you kind of saw this at an early stage. What were your thoughts? What stuck out for you when you saw these?
What stuck out for me was the quick capture, because in any incident or event, you want to meet the person where they are, not where you are. And if you can do that quickly and escalate quickly to get support, that's really, really beneficial to the person on the, who was actually dealing with that incident, or that person who may be in distress, or a support member who's maybe said a mistake, and that person you transport is in distress. So that quick capture and that quick escalation in terms of what happens behind the scenes was really, really beneficial.
So in terms of best practice, we touched on these kind of care pathways a bit. Carrie, you probably are the best person to explain exactly what they are and how they work as well.
And everybody in this room, I'm sure, will know that if somebody says to you, put best practice on one slide, it's a really tall order. So we wanted to develop a way to help people follow best practice. And that really meant helping them make sure they filled in the right information at the right time. So we know if somebody has a fall, this is the kind of information you really want to be looking for and looking to record. So we built different pathways per event type to allow people to really focus on the information that was very, very important for those types of events. But we also understood that incident management is not a linear process. And when you're tasked with, build these pathways, it's really, you have such an urge to just go, here's your start, here's your finish, and what to be doing in between. And the reality is you go backwards and forwards in that throughout the time you investigate it. And it could be a very simple event that, yes, you can look at it and go, absolutely, we did the right lens, nobody's come to harm, we could take lessons there, great. And then you have much more complex incidents that information emerges over time. And somebody did see fine to begin with, and 5 days later, actually, we discover they've got a fracture and that it was much more serious to be thought, and there are people who are involved that it's taken time to speak to. So we really appreciated that there was a level of complexity that we wanted to help people deal with and manage, and be able to have the flexibility to go backwards and forwards as information became available, but still at the end of the day give you a very clear visual and chronological view of what happened for this person, for our teams, for their family, and how we managed that together. And therefore give best practice care, but also help you with your best practice around quality governance. And the reality is that the good data in means you get much more meaningful data out. So we can really make sure that people did get the right care, and that we then responded to that appropriately and we learn from it. We also developed some pathways around the actual care following vet. So falls is a really good example, and it's the one you can see up there, which is if somebody experiences a fall, there are certain observations or checks we'll need to do potentially over a period of time after that fall. And we wanted to make it really easy for care teams to do that and go, yeah, I've checked this, I've checked that, I've checked them for head injuries, I've checked them for fractures. We want to make sure they've checked all of that. But we also want the manager that's coming in the back to be able to see that, so that I don't have to come in and say, this person's experienced a fall, go and get their care notes, or log in somewhere else and see their care notes, and then go back to my incident management system and go, yes, we did those things. Because they're already there in that view. Where the care team have recorded it is exactly where you should see it, which is part of those incident reports. And that was really, really important to us. And it was the same with behavioural pathways, making sure that, those post-restricted practice monitorings happened, recorded, and you could view those, how long those took. So that was a really key driver from what we wanted to do with incident management. We didn't want a generic form. We wanted everything to be very tailored to make sure you were getting the most out of the information that was being captured.
I think you did that incredibly well. I mean, for me, this is one of the biggest positives from this system is whatever the incident category type, the pathway is completely specific to that type. So all the tasks you would need to do if it was an allegation of abuse, or if it was a fall, or a behavioural event, or a burn, or a pressure ulcer, or anything like that, the pathway is so bespoke that it takes staff team and the manager through all those things they'd have to do, whether it's raising a notification, duty conduct, etc., whether it's about the person, whether it's about the employee or the team as a whole. It takes you through that whole flow so that there's nothing left to question, which is probably something I've not seen from any other incident management system. That may be the case, but I've not seen one.
It might sound to some people here that sounds very complicated and needs a lot of configuration, a lot of time to set up. It's not the case.
No, it's not the case. We just got given it. I carry out. We talked about it. You guys went away, did it, and when we turned it on, it was all there.
Yeah, but yeah, it was customers like you and others in the sector that we work with to help shape what those pathways look like, so that they essentially work out of the box without configuration.
It gives managers reassurance that, it's not a tick box exercise, but it gives them reassurance that they're doing everything they need to do and they're capturing it all in one system, which is also the other benefit. We also use Nourish Better Care, so having incident management and the care records in one system is just absolutely fantastic.
Yeah, both in terms of being able to capture it and then manage that alongside the care of that individual. So data visibility, this was another key pillar for us. So, and we can see here is one of our event dashboards, which looks very simple, but is actually really powerful. So when we spoke earlier about making sure that all of that good data is being captured, this is where you really see the benefit of that. You can really then start to slice and dice the data with all of the filters working together to be able to make your data tell a story. So it could be things like, yes, there's a lot of events happening, but these are perhaps all concentrated in a particular service or a particular time of day, or perhaps of a particular severity at a time of day. And being able to kind of combine and look at these data that are points together allows you to really investigate that data and understand what are the patterns, what are the trends, and then perhaps what can we do and to reduce the number that are happening on the severity of ones that are here. The other thing that we did was built this real-time event tracker. So there's some data in Nourish which isn't 100% to the minute, and that's fine for certain analysis. When we spoke to people about events especially, I think one of the things we found was that's not going to work if I need to manage loads of events, and I need to understand what is the latest details on those events. It needs to be up to the minutes. And so the event tracker allows you to see all of the events within an organization, filter and sort that by the criteria that matter most to you. There might be the severity of those events, it might be where they happen, the time they happen, the status of yours. And then because obviously it's in the same platform, and just click through to flick of a button and see that all of the interactions, if the care that happened around that event, all of the follow-ups that happened, and then everything that happens before and after.
I want to say about the event tracker, when I kind of do a demo of this to my managers, first thing I said is, when can I have the event tracker? Where can I have the event tracker? Then it's coming. And then I went to the northeast, one of our hubs the other day, and I walked through the room, and one of my managers went, Lyndsay. I said, yes. She's also called Lyndsay. So I said, yes, Lyndsay. She said, there's a event tracker. I said, yes, it's a game changer. Come and look at what I can see. I said, but no, I can see. She's like, well, come and look. So very excited about it. Very, very helpful.
Brilliant. So
it's game changing.
Thank you.
In getting your managers on board is half the battle, right? You want it to feel like it's working for them.
Yeah.
Yeah, which was perfect segue actually to talking about the rollout of Nourish Safety at St Anne's. I think we said it was 4 or 5 weeks ago.
Yes.
How was it getting set up in the first place?
I mean, we have been on a journey with Nourish for the last year with Nourish Better Care. So I've spoken before about how we did that, which was in a bit of a strange way. I didn't get a project manager in to roll out, a massive system change, which people generally would. What I did was I went out to my operational workforce and the people we supported and said, they've got an opportunity here. And for Nourish Better Care in terms of care records, we built that as a project team of 35 people who worked in operations in some central departments for early adopters, the people in different areas who would run with this, design it in terms of how we need to use it for our services. And because we've done that and we've done a bit of choice architecture around that kind of fudge theory of getting messages out, because, we have to live in the world that our care workers live in, and they don't live in the world of reading emails every day. So it's face-to-face contact, multiple meetings, multiple webinars, options to come to different learning events, all my quality team outing services, all my area managers outing services. All the conversation was about Nourish Better Care. And then when we rolled out Nourish Safety, everyone was so versed in using that, and it was all in the same system, that the adoption was very, very easy. So we did the same again. We did a program of webinars, outing services, and face-to-face discussions. I went to one service and it took me, I tagged myself about 12 minutes to teach each individual staff member how to use Nourish Safety. So it's very, very intuitive. We bought Nourish anyway because of the end user experience in terms of the staff. So it was very, very simple actually. And because they're well versed in, we've got to give credit to our teams. They're so knowledgeable anyway in accident, incident and risk management, that learning this was very, very intuitive, and that was the biggest benefit. And then when they can see the outcomes and actually how quick it was to escalate things and get that support, it just kind of, worked itself.
Brilliant. So a year or so to roll out Nourish Safety, but then Nourish core platform, but then launched it a few weeks or so for Safety.
Yes.
And so
Very bad to do have 134 locations, so wasn't escort.
not a smooth task. Yeah, it's very impressive. But having now been using it for 4 or 5 weeks,
Yeah.
are you starting to see some of the impacts of using it?
Yes, we are. So,
In general, I've just had my 360 appraisal, which, is always a daunting time. But what came through really, really strong in that was that I've driven and led Nourish implementation and Nourish Safety into the organisation, and everyone is finding it a benefit. I haven't really had any feedback or any negatives about it, and I do ask every time I go out. We have had a case study recently where we have one person who lives in one of our services who ligatures, and they do it as a form of self-soothing and a form of self-harm. And in terms of using data in the system, we want you to make our culture accessible to our support workers in terms of learning. So there is confidentiality within the system, but also we have to have an open culture where we can see that data together and learn from it. So that the employees could see that data, especially in the dashboards, and they identified very, very quickly using Nourish Safety and Nourish Better Care in terms of the interactions that were happening before and after, a clear pattern. And they were able to take that to that person and say, can we have an honest discussion with you about what we're seeing and help you understand that some of, your self-harm and ligature is actually coinciding with your connections with these people in your life. And that doesn't mean that's a negative thing, but how can we help you, remove some of that or help you with the stress of that? And that person was really open to that safety plan, and seeing that information kind of in an accessible way for them really kind of kick home that actually some of the people that they may have been associating with weren't okay. But they came to that decision together instead of staff saying, no, they're not very good for you, or, so they can see, and it was true. And their instance have actually reduced from 150 runners to 30. Yeah. So very, very significant. But that's about, collaboration and working together.
It's so powerful to be able to use that data with the people who support as well. So it's not just an organisational tool that sits out here that nobody else really understands. It's really embedded into everything you're doing to support the people you're working with. Yes, absolutely. And for anyone who writes committee reports like me, it's an absolute godsend. But that's the other end of the spectrum.
Brilliant. So obviously we've been on a bit of a journey with Nourish. Like I say, it's about a year ago. We started building it. Started having these conversations to understand what problems were, deciding what to build. We went into early adopter program in the summer. It's now in general availability, and as of last month, we have around 20 customers who are already signed up and in some various stages of starting to use it. A whole load more who are really excited, but obviously we don't want to stop there. We realise that there's more to come, and so a couple of things to call out there. I think that we're working on right now that we're excited about. If you haven't seen it already, we're launching a new Better Care home app, and safety is going to be in as part of that app in the next month or two. So that will be available for home care customers. We also built a special home care specific events library to go along with that. So it's not just taking what we've done in residential, it's trying to make it work, actually building a specific events library for it. And perhaps one of the other things as well that's really important for us is around staff and service events. So we've built these event pathways that are focused very much around the individual, but we also understand that there are events which happen more at a service level or a care level. We need to be able to support, to build those pathways out to manage those as well. But those are just a couple of things. We'll continue to develop this product as we learn, and for customers like Lyndsay and for anyone else, what's working and what we need to adapt. So, the take-up's been really positive. We're really excited about it. And if you are too, then please come for a demo. We are over at G40. I think there's a little subtle double-decker stand. Our team are there. They would love to give you a demo, see if you can log an event in 30 seconds and see all of those workflows in more detail and really get to understand it. And that is it for us. We've got a few minutes left, and if anyone has any questions. No? All right, well, thank you so much for having that. Oh, have you got a question over? Sign. I think we might have a roaming mic somewhere.
So to find out, do you have the option of notifying CQC or the app? Okay? Do you have the option to notify CQC of any incident on the app?
Yes. So even as the reporting to CQC, Bridle, safeguarding, adult spawn protection, if you're from Scotland, they're all built into the workflows, but they're also part of the event trackers that as a manager you can have an oversight of, okay, which ones were meant to be reported, which ones have been reported, where are we in that, same as safeguarding, which ones have been referred, which ones are still outstanding and nobody's kicked them up yet. So all of that is built into the workflows, but then visible from your tracker so that you don't have to go in and out of all of the documentation without seeing that really important information at a high level. Thank you.
Hiya, I'm probably maybe old in the internet. I'm used to your internet going off constantly. Handrail bust is the system.
Sorry, I didn't catch that.
The internet, so what if the internet goes down? They're not connected.
Right, yeah, so our native Carrie apps are built with that in mind. We understand that actually that internet connections are not always the best, and can log an incident in that offline mode, and that will then work later. To answer your question. Okay, I think we're coming up to time there, so just want to say thank you so much for coming and for listening, and please come for a demo.